Everyone, thank you so much for that introduction. Um, as we already said, I'm here to talk to you guys today about VETIGEL, how to use the product, a little bit about it. We're going to go through some different cases that I've seen over the years where this product has really helped out. Um, so we are going to go ahead and get going. So to just tell you a little bit more about me, just to let you know where I'm coming from. As was mentioned, I have 4 cats. Those are my 4 troublemakers right there. And then my horse Reggie is in the picture there with me. So I work at the Virginia Beach SPCA, and we are a combination facility. So we, of course, have an animal shelter. We are a private 501(c) nonprofit entity. We take in owner surrenders, we take in transfers from other shelters, we assist with national disaster response, and we also take in all of the orphan babies for our local municipal facilities that aren't able to take care of them. So through our shelter, we serve about 2,500 to 3,000 animals a year. We also have a public-facing veterinary clinic. So we are the only low-cost, full-service veterinary clinic in our region. We are extremely grateful and thankful to be well-funded so that we're still able to provide a high level of care. And we serve families that make $65,000 or less per year, as well as our military and first responder families through that public clinic. We also have what is lovingly known as our neuter scooter, which is our mobile surgery unit. We go out to about 12 different rescue and shelter partners that don't have their own veterinarian. We also go out to more rural areas of Virginia where vet care is hard to come by, and we provide wellness care as well as spay neuter services on that. And we have a small wildlife department where we provide triage and rehabilitation services for wildlife that are found within the community. So I work with a team. We have a total of 7 veterinarians at our organization. We serve about 12,000 clients from the public through that public-facing vet clinic every year. So we're very busy. And because of that, we see a really wide variety of patients. So I see everything from the very newborn neonates to elderly patients. Because we do have so many vets and we provide so many services, I also get a lot of referrals for illness and surgical services, either from other area, just general practice clinics, but I also get a lot of emergency referrals too, when folks can't afford the estimate there. Because I see so many different patients in a lot of different capacities, this has led me to utilize VETIGEL in a lot of different ways. So we're going to kind of go through that today and talk about ways that I find it to be useful. So why is VETIGEL important, even to begin with? Why do we care about hemostasis? Most of us have heard that phrase, all bleeding stops eventually. I know I heard it in all my vet school lectures, and it's meant to be a way to calm us down, right? To think through, okay, we can stop this. And it's true, all bleeding does stop eventually, but our aim should be to stop it as quickly as possible in order to minimize harm to the patient. And even though bleeding is life-threatening, there hasn't really been a lot of advancement in the world of hemostasis if you look back through history. And so what VETIGEL aims to do is kind of change that thought of all bleeding stops eventually to all bleeding can be stopped quickly and effectively. So I'm not going to bore you with a super long history lesson. History was never my favorite subject in school, but I am going to talk a little bit about it so you can understand where we've come from and where we are today. So if you look back in the literature and research, we've been using hemostatic products for thousands of years, both in the human and animal field. If you go back to the 2nd century AD, you can find descriptions of using pressure, twisting, ligation, cautery, and hemostatic products, although hemostatic products during that time included things like powdered ricins and clay. In the Middle Ages, they kind of tended more towards cautery with hot irons when they were doing operations. And at that time, blood was considered unclean, and surgeons actually had a really low social status compared to physicians because we knew bleeding was bad. We didn't want to deal with it. And so if you were a surgeon, you were kind of bottom of the totem pole. When we moved into the 18th century, then we started moving more towards using ligatures, and actually chromic catgut, which people still use today, was first manufactured in 1870. If we look at kind of modern day hemostasis, there are a lot of hemostatic products on the market, whether it's a powder or a mat or a sponge, foams, impregnated gauzes. They all tend to work in a similar way. They usually contain one of a few common materials, and they usually work as a matrix, which then allows the blood to clot more easily. So because of the way that these work, They tend to take a little bit of time to work. They do need to directly contact the blood in order to function, and they integrate with the clot. So if you're in a situation where you need to remove that product, that can be problematic. It also means that because it's depending on that product to stay in place, your clot can get easily dislodged and your bleeding might restart. Because these products need to contact blood, that can lead to a messy surgical field, which can make it difficult to visualize things during a procedure. And so a lot of people kind of feel like, why do I need a hemostatic product if I can just sit here and put pressure, or in some cases use my cautery or tie a ligature on it. And so in one study, 65 to 75% of veterinary practices in the United States and the UK either rarely or never use hemostatic products, which is kind of crazy to think about when you consider how bad bleeding is. So what is VETIGEL? Why is it different than these other products? So VETIGEL is made from plant-based polymers, so it's all very biocompatible. It's able to rapidly withstand high pressure bleeds because of its viscosity and its cohesive strength. Basically, the way that it works is it's in a syringe, which I'll show you in a little bit. You can use that syringe to get into wherever you need to apply it. Because it's a gel, it can conform to different wound geometries, and it has a little precision attachment accessory that you can utilize to get to difficult to reach places. So if you have to get in somewhere teeny tiny, you can do that with the precision tip. It does work to stop bleeding immediately, and the most important thing is it avoids clot integration. So if you have to remove the product, or if the product becomes dislodged, it's not going to take the clot with it. So that is a big difference between this and some of the other products that are on the market. As I mentioned, there are plant-based polymers in the VETIGEL. They work to stop bleeding immediately. So those polymers form a mechanical barrier at the wound site. There's ionic cross-linking that goes on that ensures that that non-porous gel adheres to the site, but also does not actually integrate with the clot that the patient is forming. So your patient is creating their own clot independent of the product. So this is a picture that shows you the syringe that VETIGEL comes in if you've never seen it before. It does arrive in sterile packaging, so this is something that you can utilize during a sterile surgical procedure. That's another view of the syringe. And then you can see in the picture next to it, that's the precision accessories that I mentioned. I'll go into a little bit more detail later on about how I use them, but by using that precision accessory, you can get into smaller places to apply the product. So think like a dental procedure. Sometimes if you need to get into a hard to reach place, that precision accessory can be really helpful in those instances. A lot of times I get questions from practitioners about why VETIGEL, where does it fit into my practice, what are the different cases I use it in. It's really useful in any procedure that involves bleeding, but where it really shines are in cases where either ligation or cautery are either not reasonable or effective. I use it a lot in my pediatric and geriatric patients, which I'll highlight a little bit more with some of our cases in a bit. It is useful in exotics. I get a lot of questions from folks about if they can use it in their bunnies or their rabbits or their rats or their birds. Yes, you can use it in exotics. And the nice thing is there's no setup or preparation. So it is very useful in emergency or trauma types of situations. It's easy to just pick up and use once you know how to use it. So things to keep in mind before we start and dive into a little bit more of the details. The high points of it is there is a learning curve with this product. So the number one complaint I've gotten when I've spoken with folks that have used it, if they're unhappy with it, is they were in a situation where a patient was bleeding. They knew nothing about VETIGEL. They saw it on the shelf and thought, ooh, I'm going to grab this and use it. And they just squirt it everywhere in there. And then they're disappointed when it doesn't work. So you have to understand that the way that this product works and why it works the way that it does. It's pretty easy to understand and to use it. It doesn't require a lot of hands-on practice, but it's not something that's going to magically work if it's not applied in the appropriate way. It is important to remember that it is a hemostatic agent only. It's not an antibiotic, so you can use it in infected sites, but you still have to treat the infection. It's not pain management. You still have to use those sorts of things, but it's safe to use in infection, neoplasia, trauma, all of those sorts of cases. Very easy to stock on the shelf. It is temperature stable. Once you've used it, if you don't use the entire syringe and you want to use it again, it does need to go into the refrigerator for storage at that point, but just your fresh out of the box can just sit on your shelf. It has a good shelf life. So again, easy to stock and important to always have on hand, right? Because you can't predict when bleeding is going to happen. You don't want to have bleeding happen and not have this product on hand. So I'm going to go through some different cases with you, talk through specifics of how I use it in each of these different patients, and we will go from there. So our first topic is enucleations. This is one of my favorite uses for it and one of the first ways that I really use the product. This is the first patient I ever did an enucleation with VETIGEL in. This is McCree, a tiny little shelter kitten that's probably about 3 years old now. So the thing about enucleations that is really great when using this product is that enucleations tend to be high bleeding procedures, both from the tissue within the orbit, as well as the vessels associated with the eye and the optic nerve. And so if you think back to vet school and anatomy and lectures, when you're dealing with vessels in the orbit, we have to be careful that we're not pulling on the optic nerve, because if we pull on the optic nerve, we can blind the other side. So if we're trying to ligate something in the back of the orbit, we have the potential to cause damage there. It can be difficult to get down in that orbit to perform ligation, but these vessels can really, really bleed, right? And again, all the tissue in that orbit, even if you have ligated the major vessel, you can still get oozing and bleeding from it. So when you are using VETIGEL in these procedures, you get quick hemostasis of all the bleeding vessels in the orbit, and it kind of takes away that risk of pulling on that optic nerve and blinding the other eye, which is nice. So this is another one of my shelter kitties. I actually had an entire litter of kittens that all had eyes that kind of looked like this. My favorite of the bunch was Apple Pirate, who was adopted by one of my technicians, who we'll see a little bit later. So this highlights not just the use of it in enucleations, but also how it's really helpful in pediatrics. So this group of kittens, they originally came to us. They were all about 4 weeks old. The one I was most worried about was Apple Pirate. These guys were all underweight. They all had severe upper respiratory symptoms. They were dehydrated. They're having diarrhea, but they were willing to eat and they were quiet and resting comfortably. If you've done a lot of work with pediatrics, you know that these guys typically cry if something is wrong. And so although we knew that a lot of them were potentially going to need to lose their eyes at some point, we wanted to initially stabilize them. So we gave them nutritional support, antibiotics for those upper respiratory infections, antiparasitics. For the eyes, even the ones we thought we weren't going to be able to save, I do always go ahead and medicate them and make sure to give them good lubrication for comfort. They all needed some fluid therapy. We did a lot of IO catheters in these guys. Getting IV catheters in these teeny tiny ones can be difficult when they're dehydrated, so IO catheters are great for that. We knew we were going to have to watch these guys really closely to determine where that tipping point was for where we needed to go to surgery as opposed to continuing to medically manage them. So we made sure that they were in a dedicated medical foster home, and then made the decision we weren't going to pursue surgery until these patients were bigger or things changed. So about a week later, they were all gaining weight reliably, but in Apple Pirate particularly, medical management was producing limited results, and we were not having good luck controlling her discomfort. She was vocalizing, but her URI signs had improved and her diarrhea had resolved. So we made the decision that it was time to take her to surgery. Thankfully, she was less dehydrated at this point, so we're able to go ahead and get an IV catheter in her. I do always intubate even my teeny little babies. It's just better to have that secure airway. Heat support in pediatrics, I can't emphasize enough how important that is at this young age. We've got to watch their body temperature very carefully, but because they can't regulate, you have to watch that they don't swing the other way and become hyperthermic. In enucleations, I always emphasize using local blocks to minimize your anesthetic use. We have to be really, really careful of our anesthetic use in young kittens like this. We have to watch their blood glucose really closely because these young ones can't really regulate their blood glucose as well as some of the older ones. So then when it comes to doing the enucleation itself, as you're working, you want to stick close to the globe and avoid excessive tension. Again, we don't want to blind the good eye if there is one left. And then this is where the VETIGEL comes in, is for control of the bleeding. You get really good control of the bleeding if you fill the orbit entirely. And then this is important, and I'll go through it when I kind of do the step-by-step breakdown of how to do this. But enucleations are one of the very few procedures in which I recommend removing the product prior to closure to eliminate the need for the body to break it down. So in almost everything else you do with VETIGEL in the abdomen, in the mouth. And when I talk about using it in neuters later on, you can leave this product in, it's biocompatible, the body will break it down and eliminate it. However, when you use it in an enucleation, if you leave it in the orbit, as the body breaks it down, it has to go somewhere, and there isn't a lot there to reabsorb it into the body. And so you can see this sterile discharge form coming out of your incision, which panics the owners. If you're in a shelter like me, it panics your foster families. It's uncomfortable for the patient. And so you're going to want to leave it in long enough to get your bleeding to stop, but you do want to take it out before you do your closure. So there's Apple Pirate looking nice and happy. As a grown-up, that is actually Apple Pirate in her forever home with my technician. She did really great. As you can see, she's a lot bigger now than when she was just a teeny tiny little thing. So specifically, how do we use VETIGEL in enucleations? So when you're using VETIGEL for anything, you want to go ahead and prime your VETIGEL syringe. So what I mean by that is you take your syringe out of the package using sterile technique if you're using using it in a sterile procedure. There's a cap on it that you want to go ahead and remove, and then you want to just gently dispense a little bit of the product until it comes out to the tip. That just makes sure that you're not having any air holes or anything like that. You're getting enough product out. So go ahead and do your enucleation with whichever technique you're most comfortable with. And once you have removed the globe itself, take a sterile gauze, put it into the orbit to wipe away any excess blood. Then you're going to take your VETIGEL syringe, put it all the way down into the back of the orbit, and start dispensing the product out of the syringe. As you're dispensing the product, you're going to slowly back the syringe out of the orbit. Once the syringe is out, you want to make sure that the product adheres to the area by kind of swedging the syringe off to the side. The easiest way I can explain that is if you've ever caulked anything, think about how you have to get a good seal. Your caulk isn't going to work if you don't cover the entire area you're working on, right? So with this product, because it works by creating a mechanical barrier, you need to get a good seal on there. Now, let's say you're like me and you've never caulked anything in your entire life and you have no idea what I'm talking about as far as getting a good seal. If you've put the product in, and this goes for any usage, if you've put the product in and you're not sure that you've gotten a full seal to create that barrier, you can take a sterile gauze moistened with sterile saline and just gently put it on top of where you've applied the product and put just a little bit of gentle pressure on there. That will help the product spread out and cover any areas that you didn't get with the initial seal. VETIGEL does work very, very quickly to go ahead and create hemostasis. For nucleations, I usually wait 1 to 2 minutes after I've applied it to confirm that hemostasis has occurred. And what I mean by that is if I'm using the gauze technique, I'll remove the gauze. If I'm not using the gauze technique, typically while I'm waiting, I'm like getting my suture out. If I'm doing a bilateral enucleation, I will actually put the VETIGEL in and move to the other side, from the enucleation on the other side while the VETIGEL is sitting in that orbit. But whatever I'm doing to keep myself busy during that time, I go ahead and do that. After the minute or two has passed, I look at the area where I've applied the product. If you've achieved hemostasis, you won't see any bleeding. If you see a little bit of blood oozing out from the side, it means that you did not get a good seal. Just go ahead and take that sterile gauze with the sterile saline, put a little bit of pressure on there, again, for another 1 to 2 minutes to complete the seal. Once I'm sure that I have good hemostasis, this is when I go ahead and remove the product from the orbit. I always rinse my enucleations out anyway before I close, so no different than that. I use a sterile gauze and I will wipe the big chunk of product out of the orbit, and then I take sterile saline and rinse it out. The goal is to remove at least 95% of the product from the orbit. You don't have to worry about removing every single little molecule of it, but you want to make sure there's no big chunks left in it. Again, because if we leave product in the orbit, it can cause discharge from your incision, which makes everybody unhappy. And then once the product is removed, you can just proceed with your closure as normal. So this is a video from a colleague over in the UK, Dr. Vargas Smith. She is an exotic specialist, and this is her using it in a rabbit enucleation video. She uses a slightly different technique than I do, but it demonstrates the point that we can use it in a lot of different ways. in order to achieve hemostasis. So she actually, because she's working in a rabbit, the way that she describes it is that she, at every step of the way, she doesn't want any little bit of blood loss. So she uses it at multiple points. Every time she makes a cut and she gets a little bit of bleeding, she puts some product on. There she is using a sterile gauze to put just a little bit of pressure to get a good seal on it. She pulls the gauze off after a minute. She sees that it's stopped bleeding. She goes ahead, she removes what she needs to. She sees a little bit more bleeding, so she's gonna wipe away the excess blood, get her gauze ready, get her syringe ready, apply a little bit more product, and then she's gonna go ahead, because she's not sure she has a full seal, put it back down. Now she's removing some extra tissue, so she's gonna get a little bit more bleeding. So she's just cutting that away. I have a little bit more bleeding, so she's applying more product. And there she is putting, again, just that very gentle pressure on there to make sure that the VETIGEL has a good seal. And then again, you want to go ahead and remove the product before closure, just so that it doesn't break down. The next most common reason that I use VETIGEL in my practice is in dentistry. I do a lot of full mouth extractions at my practice, both from cats with stomatitis, as well as dogs that maybe have never had dental care before in their life and need everything out. So unfortunately, I do take quite a bit of teeth out. Anyone that has done dentistry before knows that extraction sites can bleed really heavily, but it's also really hard to ligate things in the mouth. Cautery isn't always the greatest, when you're working in that's not a great option, working mouth. And so a lot of times we're sitting there holding pressure, thinking about how long our patient has been under, because dentals do take a long time, right? And watching their blood pressure. The other thing is, if you're like me and you're not perfect and you've ever broken off a root tip when you're doing a dental extraction, bleeding can make it really hard to visualize that root and go after it. So VETIGEL is great for getting in there, stopping the bleeding, and then you can get rid of the VETIGEL so that you can see what you're doing. It's also really nice for working with oral masses. Sometimes those oral masses, can be really hard to get tissue to come back together for closure and or to get hemostasis. So VETIGEL works really nicely for that. So this is my buddy Grover. Grover came to us a couple of years ago now. And Grover was what we like to call the hot mess express here. He actually originally came to us for euthanasia. He had been passed around to a couple of different families. And the last gentleman that ended up with him just kind of realized, I'm in over my head. I can't provide the care that this boy needs. And I don't want him to continue suffering. And so he came to our shelter and said, I don't have any money for euthanasia. I don't know that he can be helped, but can you please do something to help this poor, sweet boy? So the staff brought him over to see me, and he just had the brightest sparkle in his eye. For everything else he had going on, he had this really sweet sparkle. And we thought, well, let's just take a look at him and see if we can't patch him up. So on his initial workup, he had a body condition score of 2 out of 9. He had a severe flea infestation. His lab work showed that he was anemic. He had some changes related to the poor body condition. He had a grade 3 out of 6 left systolic murmur, but his chest radiographs were unremarkable, which is always good. He had a really severe dental disease, and he loved food. If you showed him a biscuit, his tail went going. He got really excited. Show him a can of food. He was all about it, but then he would try to open his mouth and he just couldn't. And his people thought he was maybe about 10 to 12 years old, but again, he had been passed around a lot, so no one was really sure. So looking at his lab work findings and recognizing that he was having difficulty with his mouth, we knew that we needed to do some further investigation for him. So we went ahead and did a comprehensive dental procedure for him. Took a look at everything. We always get full mouth radiographs pre-extraction and then our post-extraction radiographs. I get a lot of questions about, hey, working in a low-cost clinic, do you guys do dental radiographs? Absolutely. I will not do dentals without them. It's not optional here. In any dental, you always want to focus on keeping your anesthesia low, but especially in this geriatric gentleman with all of these issues, we knew that that was going to be a consideration. So we do, of course, always do blocks to help with that. Fluid therapy in geriatrics could be a whole several-hour lecture series in and of itself. But especially in this guy, we had a couple of different reasons why we were worried about it. We knew we were going to have to really balance things watch his blood pressure. We were very concerned about blood loss in this sweet boy. So we knew we were going to need really excellent hemostasis. Heat support is always important. We use bear huggers here to help keep our patients nice and warm and comfy. And then with dentals, I just always tell people, you have to watch your timing. It's very appropriate to stage procedures if needed. And if you're not comfortable, don't be afraid to send these to a dentist. But all that said, I see a lot of referrals for older patients that have been, it's in the medical record that, this patient is too old to have a dental. Age is a number, it's not a disease. And even when there are some other, comorbidities, dental disease is a massive quality of life issue for these patients. And so if we can get them to a dentist, if we can get them to somebody that would be comfortable pursuing this, always keep that in mind. So here is poor sweet Grover's mouth. As you can see, it was not in the best of shape. There were not any teeth that we were able to salvage. So this is not from Grover's Dental. This is from another colleague who sent this over, but this is going to demonstrate how we utilize VETIGEL in dental extractions in order to get that good hemostasis. So they're using the precision accessory tip in this video. I typically always use that in dentals just so I can get into the extraction site and I'm not wasting product. So it's very easy to use. One syringe of VETIGEL will typically last me even for an entire full mouth extraction. The way that it works, as you saw in the video, we do typically use the adapter and precision accessory. So if you're using the precision accessory, there is a little adapter that comes with it. The adapter and the precision accessory can be autoclaved to re-sterilize them. But you want to go ahead, you take your syringe of VETIGEL, you put the adapter on it, you add the precision accessory, then you're going to prime it just like you would if you're just using the syringe. Then you want to go ahead and use a gauze to wipe away any excess blood so that you can see what you're doing. Then you're going to take the precision tip of the VETIGEL syringe, put it all the way down to the bottom of your extraction site, then go ahead and dispense the product and back it out. You want to fill the entirety of the canal. And again, at the end, you want to kind of swedge the syringe off at the end to adhere the product to the tissue as you exit the canal. Because you're filling a small little space, I don't usually have to use that gauze technique to, get a good seal, but certainly you can use the gauze technique if you're noticing some blood oozing up out of the extraction site. Again, this is a situation where you can leave the VETIGEL in during closure. A clot is going to form underneath it. I get a lot of questions about the importance of clots in dentistry. A clot is still going to form, so you are still going to get that important healing. But again, if you need to go and retrieve a root, you can go ahead and take that VETIGEL and just rinse it out so that you can have better visualization. So Sweet Grover did absolutely wonderfully for his dental. Within 3 hours of recovery, he ate an entire can of BN. He went out for a nice walk afterwards. He got sent to a wonderful foster home that ultimately adopted him. His anemia and his heart murmur resolved in the weeks that followed. And I just saw him about a month ago, and he is kind of unfortunately fat now, but otherwise doing really, really well. So he's a great example of how, VETIGEL was really useful in making sure that this guy that really didn't have any blood to lose, that he didn't lose blood. It was much easier to maintain his blood pressure because of how well he was doing. That nice, excellent hemostasis helped us visualize as we were taking these teeth out. It made closure a lot easier. His entire procedure was done within about 2.5 hours, which is helpful when you're trying to keep some of these more delicate patients stable under anesthesia. So he did really great. I mentioned that I use VETIGEL for oral mass removals and also cases of gingival hyperplasia. For these ones, you want to go ahead and remove the mass or excess gingival tissue, have that VETIGEL syringe primed. If you have smaller based mass removals, the precision accessory tip may be useful, but a lot of times I'm just using the syringe for these. Again, you can use that gauze technique if you need to get a good seal. And I would say that most of the time when I'm working in the mouth, I do have to use the gauze technique just because it can be hard to get a good seal on the tissue there. When you are working in an area where you have kind of a more open area, it is important to apply the VETIGEL perpendicular to the area of the bleeding. So we worry less about that when we're filling the orbit or filling an extraction site. But applying that product perpendicularly allows you to get that good seal. And you want to make sure you use enough product to completely cover the area of the bleed. Otherwise, you won't get a good seal. And take that moistened gauze over the area by gentle diffuse pressure. Typically, I leave this in place for a minute, and then you can take the gauze off and confirm hemostasis. The next topic we're going to chat a little bit about is mass removals. So do use VETIGEL for a lot of mass removals. The nice thing about using it for mass removals is that you can use it to address multiple bleeding vessels at once, in addition to addressing oozing from the subcutaneous tissue and muscular layers. I actually really love VETIGEL for mastectomies because you tend to get a lot of oozing as you're removing the tissue. Once I've removed the chain, I can take VETIGEL and just coat the area, and it takes care of all my bleeders at once, which is really, really lovely. So if you're using it in a mass removal, just like before, you want to gather all your materials. I do typically use the sterile gauze with saline for my mass removals just to get a good seal. I don't usually use precision accessories unless I'm working in a hard to reach area, which I have a video of here in a minute that demonstrates that. Basically, you're going to go ahead with your mass removal, use that sterile gauze to wipe away any excess blood because you want to be able to see where the bleeding is and ensure a good seal. You're going to place the VETIGEL syringe, again, perpendicular to the area of mass removal. That's important in this application. You're going to apply the VETIGEL, being sure to cover the entire area of the mass removal. When you get to the end of the incision, you then anchor the VETIGEL to the surrounding tissue, again, by swedging it off. Use that moistened sterile gauze and place light, even pressure over the area of the mass removal. Wait 1 to 2 minutes, depending on how heavy of bleeders. You know, if you're just dealing with a little bit of light oozing from the sub-Q, 1 minute is enough. If you've got some bigger vessels in there, give it a good 2 minutes, then evaluate for hemostasis, and then you can go ahead and close as normal. No need to remove VETIGEL when you're using it in a mass removal. So this is a video from a surgeon who utilized it in an internal mass removal. You can see that's a pretty strong bleeding vessel there.
Action.
Okay.
Good. Just stop. Okay, stop.
So as you can see, it is able to withstand even high pressure bleeds. You can use suction around the product, although again, you know, you don't want to suction a clot directly, right? But you can use the suction around it. You can remove the product afterwards if you would like, although you don't have to. In this instance, you remove the product just to demonstrate that it was independent of the clot. The clot was still there. The next topic I want to talk about is amputations. I do a lot of amputations in my practice, unfortunately. The pity over there, that's Hiccup, and Hiccup was a gunshot victim that came to us from North Carolina. And then the teeny tiny little guy down there, that's Bear. Bear was part of a group of kittens that I'll talk about in a minute. So I do amputations in big and small, and I use VETIGEL for all of those. So one case I want to highlight where this product was really helpful was this unique case I had. It was this group of kittens with injured limbs. So I had 4 6-week-old, we thought, kittens that had come to us from another area shelter. They were found with, all 4 of them had pelvic limb injuries. 3 of them, it was the right pelvic limb that was injured. The other one, it was the left pelvic limb, and they were all missing various parts of the limb. No one knew what had happened to them. A Good Samaritan had found them and brought them to the area animal control. That animal control did not have the veterinary capabilities to take care of them, and so they handed them off to us. So whenever I mention pediatric surgery, like I talked about before, I get a lot of questions about how young is too young. And while juvenile patients have their own specific challenges, if you have a young patient in need, please don't be afraid to try surgery on them. You do have to keep in mind a couple of things. Normal renal function in our patients isn't usually present about 8 to 10 weeks of age. Hepatic function normally takes till more like 16 to 20 weeks of age. You have to keep in mind that depending on their age, they may or may not be able to self-regulate temperature. So that's important things to keep in mind. And the other thing that I find that most people forget about is that pain kills. So we need to manage pain in our patients, and pain sensation is present at birth. So even if you are working with a teeny tiny little newborn, they can feel pain. We need to make adjustments in our pain management choices based on their age. But we do need to address their pain. Opioids are a great choice for pain management in these young ones. You do need to keep naloxone on hand. You want to decrease your dose due to that hepatic metabolism being immature, and also it can decrease respiratory function. So I usually will do only about 25% of the normal dose to start, and then watch for response to my pain management plan. If you're working with a neonate that's less than 48 hours old and you have bleeding, you always need to give vitamin K. Keep in mind that you can do blood transfusions for your young patients. And the most important thing is stop the hemorrhage as quickly as possible. These teeny tiny little guys cannot lose a lot of blood. So going back to, amputations more in general, VETIGEL is great in amputations. I really like it for cases where there's been a lot of trauma to the tissue, and I'm dealing with unusual vessels and bleeding that are popping up. VETIGEL does work really well with the muscle as you're cutting through the muscle. I will say I do not use VETIGEL as a replacement for ligation of the major vessels. I use it to address all the little bleeders that pop up during an amputation, but I sleep better at night knowing that there is a ligature. I always put at least 2 on those major vessels, knowing that that is going to be under control. So as far as using it in these cases, you're going to follow. I'm not going to go through all of the, ins and outs of it like I have before. You're going to prime your syringe, go ahead and apply it, get a good seal. I find that in amputations, it can be a little bit more difficult to identify the angle at which your bleeder is coming from and the angle at which you're applying the VETIGEL, because that traumatized tissue sometimes looks a little bit wonky. You might have a bleeder going this way when the tissue is facing this way. So keep in mind that you want to be working perpendicular to the bleed, not necessarily the tissue. And then traumatized tissues, it can be a little bit hard to get that good seal over it and for the VETIGEL to grab onto the tissue. So definitely use that sterile gauze technique to get a good seal. This is an instance where you need to use a little bit more of the product in order to get that good hemostasis. So this is Sweet Little Bear. So this litter of kittens, we kind of had to, as we were working through it, figuring out when we were going to go to surgery with each of them. It is never my preference to go to surgery when they are this young, but this little guy had some changes on his lab work that led us to believe he was septic. He was not doing well clinically, and so we went ahead and did his procedure. As you can see, I do use an IV catheter in these little guys. I do intubate these little guys. Not me personally, I have amazingly skilled licensed vet techs that do this for me, so I'm very spoiled, but I do make sure that these guys have that type of support. So he did great. All of his siblings, that's him the night after surgery. He was pretty tuckered out. All of his siblings went on to have full amputations as they got bigger. They all went on to be adopted and did really well. So one of the more unusual uses that I use VETIGEL for is for happy tail. Whenever I say this, people are always like, what are you talking about? So with happy tail, we've all seen it, the dog that has the tail that just won't stop bleeding. They're banging it all over the place. The owner's going nuts because there's blood all over their house. And if you've ever done an amputation for one of these cases, it can be really frustrating because that patient then still goes home and bangs your surgery site, bangs their tail all around. We see it, unfortunately, sometimes in our shelter setting as well, right? If we're having trouble kind of controlling a patient's stress level in the kennel, if they're not responding to medication, sometimes they'll hit their tail on the wall repeatedly. And so I actually, before I jump to surgery, if the tissue is viable, I like to use a combination of VETIGEL plus bandaging to get healing without jumping to surgery. So VETIGEL itself is not going to solve all your problems. You have to use a successful bandaging technique, but VETIGEL really helps with initial stabilization of the wound and preventing further bleeding if they do happen to re-traumatize that tail. So we clip and clean the tail very well, dry it out really nicely, then apply VETIGEL all over the areas of open wound on the tail. In these instances, I'm not so worried about anchoring the product as I apply it. I'm more so just making sure I've applied it diffusely over the area. The bandage is going to help me get a good seal. So for all my happy tail cases, I use the pool noodle bandage technique. I combine it with traditional bandaging, but I incorporate a pool noodle into it because that pool noodle helps provide cushion on the tail while it's healing. That patient can then go into the kennel and hit the wall, and it's not going to damage it. The pool noodle is going to absorb that hit. I usually use VETIGEL in my first 2 to 3 bandage changes, and then beyond that, I'm just doing a traditional bandage because at that point, I usually don't have much in the way of bleeding. And everyone always thinks of dogs when I talk about this, but it happens in cats too. So this is Sebastian. He is a current resident of our shelter, in case anybody is looking for a handsome black cat. Sebastian came to us from some field workers down in rural North Carolina, and he had a very traumatized tail, but it was not necrotic, it was viable. But Sebastian is extremely enthusiastic about food, and whenever he sees food, he starts happily, knocking his tail back and forth, and he was hitting it against the walls of his condo. So Sebastian got a pool noodle bandage. He has since graduated from the pool noodle bandage. His tail is intact and beautiful, and he is just waiting for his forever home. VETIGEL is also useful in abdominal surgeries. So dropped ovarian pedicles. I work a lot with students. I have had a couple of new grads that have worked with me over the years. And even if you're not a student or a new grad, we've all been there where an ovarian pedicle tears or it starts bleeding, and we've all felt that moment of panic. So my preference is to find the bleeding pedicle and tie it off. But sometimes you have those cases where maybe it's a really obese patient, and every time you go to grab it, it just shreds, or you can't get the vessel up to a point that you can ligate it. And I have used this with students before, where we have used this to address bleeding pedicles, and it works great. So if you're in an instance where you can't get that pedicle up and you need to stop the bleeding, what you want to do is get as close to the bleeder as you can. So in order to do that, you're going to want to utilize the biological retractor on whichever side you're on. So if you are working on the right side, take your descending duodenum and retract the duodenum to the left. That then exposes the caudal pole of the right kidney, which exposes your right ovarian pedicle. If you're on the left, you're going to utilize the descending colon, retract the colon to the right. That exposes the caudal pole of the left kidney, which then exposes the left ovarian pedicle. Once you see where the bleeding is coming from, use a sterile gauze and put pressure on the bleed while you're getting your products ready. This is a great time to have that trusty technician scrub it and give you a hand. So take your VETIGEL syringe, get it primed and ready to go. You are definitely going to need a sterile gauze for this technique, especially if you cannot identify exactly where the bleeder is, if you just know the general area. So when you're ready, have your gauze, your VETIGEL gauze in one hand, ready to go. Have that sterile gauze ready to go. Take the gauze off of the bleed and go ahead and apply the VETIGEL perpendicular to the bleed. Use an entire syringe of the product. This is not a time to try to be cheap and save a little bit of money. Dispense the entire syringe of the product. Then place that moistened gauze over the area and use pressure for 1 to 2 minutes. And then take the gauze off, confirm hemostasis, and you do not need to remove the product prior to closure from the abdomen. This also works, if you've got a bleed in the broad ligament. I've seen it used before in some patients that were just kind of oozy, some animals that were positive for tick-borne diseases that had a little bit of a bleeding issue. It works really well for that also. Splenic lacerations and mesenteric vessel lacerations. Again, I work with students a lot, and again, even an experienced vet can have this happen. When you're entering the abdomen, you can accidentally nick that spleen or even a mesenteric vessel. It happens to the best of us. If you've worked with the spleen before, you know that ligation of the spleen can be tricky. And so a lot of times people just stand there and hold pressure for like 5 to 10 minutes, and you're sitting there thinking about what a terrible veterinarian you are, even though you're not. And it just makes you feel really bad. And then you finish that and you still have to go on with your procedure. Additionally, if you've hit a mesenteric vessel, then you're sitting there wondering, oh gosh, do I need to tie this off? Am I going to create questionable viability of the mesenteric vessels? What do I do? So VETIGEL is great in both of these instances. It allows for rapid hemostasis without the downsides of ligation in both of these cases. I won't read through all the specifics of this slide because again, we're covering all of the same basics, but you're working in the abdomen. So again, you just want to make sure there's no bleeding. Typically only need about 1 minute of contact time in order to get control of either a splenic or a mesenteric vessel bleed. Mature cat neuters is another one of my favorite uses. We go through VETIGEL like crazy on our neuter scooter because we do work with a lot of feral cat populations. If you've ever been there before, you get one of those, tomcats with the big old cheeks and the scrotums that tend to ooze a lot. And so some people will use like the chip clip technique, things like that. But then if heaven forbid you forget to pull that off and your cat wakes up swinging, it can create a problem, right? So VETIGEL is great because I just take the syringe, I put my precision accessory on it, I do my neuter, I squirt a little bit into the scrotum, it provides me hemostasis. I don't have to worry about the VETIGEL. No one has to risk their life by going after that chip clip while that feral cat is trying to bite them. So we use a lot of this, particularly in our mature cat neuters. VETIGEL also works really well for biopsies. If you're working in a kind of tough to ligate area when you're doing a biopsy, like the liver, it provides a great alternative to hemostasis that's efficient. As I mentioned before, you can use VETIGEL in compromised tissue, whether it's trauma, neoplasia, infection, but again, it doesn't contain an antibiotic, so you still need to treat infection as you normally would. You're going to use that same technique that we've already spoken about. So my last case today is Monty. Monty belonged to one of my veterinary technicians. He's since crossed to the Rainbow Bridge, but with the help of VETIGEL, we were able to give him a lot more good time with his family. So at the time, Monty was 13 years old, the male neutered lab mix, and he initially came in because he had hematuria the night before, and then the next morning he had weakness and he collapsed at home. So he came into work with mom. We found that he had pale gums, a palpable abdominal mass, and a heart murmur that had not been previously noted. We did some imaging, ultrasound and radiographs, and found a large mass in the cranial abdomen. His lab work showed a regenerative anemia. He was also hypostenuric. He had hematuria. Interesting enough, his hepatic enzymes were all within normal limits. So it's a little bit hard to see, but you may be able to appreciate on that radiograph the mass effect present in the cranial abdomen. On ultrasound, we were able to identify that the mass was associated with the liver. So we knew we were going to have to go ahead and do a liver lobectomy. Any surgery where you're working with the liver is likely to create significant hemorrhage and you need to be prepared. We knew that he was already anemic and he had shown us, he had that combination of weakness. His PCV was dropping as we were watching him before we had a surgery. And so we knew we were also likely to lose some blood in surgery. So we did go ahead and do a blood transfusion for Monty, which helped to strengthen him a little bit. But then I used VETIGEL in surgery in order to minimize his blood loss. So when I did my liver lobectomy, I did a broad application of VETIGEL across the area of the lobe that was transected. Again, you want to make sure you're using perpendicular application from the bleeding site. And there's no need to remove the product from the abdomen. A lot of times I'll get questions about, well, is a granuloma going to form or some sort of reaction? And in Monty's case, because he belonged to my technician and because it helped her sleep better at night, we ultrasounded him a number of times after his procedure in the days and weeks that followed in order to make sure that we didn't see another mass growing and to monitor him. And I can tell you that that surgery site looked healthy and beautiful, and I never saw any sort of granuloma formation or anything like that, despite the fact that I think it was 3 syringes worth of product were left in his abdomen. So Monty's outcome, he did really, really well. As I mentioned, he did end up passing on about a year ago now due to an unrelated issue, but he went home and continued to terrorize his family cats and make his family very happy for a number of years to come. So that's all that I have for you today. I know that was kind of a little bit of a whirlwind tour, but I would be happy to answer any questions that anyone has about the product.